So coming to question 31 of previous year NEET questions. So a 43 years old male comes to you for pre-op evaluation for hernia surgery. You finding to be HBsAg ELISA positive. You go on to evaluate this patient and find that his HBC, anti-HBC IgG is positive and anti-HBC IgM is negative. HBeAg is negative. What is the interpretation? Of course, many of us have the tendency to leave off this question because it is somewhat confusing. Okay, many people have many different approaches to teach the serology of HBsAg, hepatitis B. So I'll try my best to make you understand my approach. So whenever a question on hepatitis B comes, always remember 3 antigens. Okay. Remember see the caps and small letters also. Hepatitis B, SAG. So see the caps and small. We have HBCAG. HBeAg. So capital H, capital B is hepatitis B. The small s is surface, Ag is antigen. Hepatitis B surface antigen. Also called Australian antigen. HBCAg is hepatitis B core antigen. Core is it is present within the structure of the hepatitis B virus. HBe is E antigen. Okay. Envelope antigen. Remember, since core is within, core antigen does not come out. So in clinical context, we don't measure HBCAg. So these are the 3 antigens which are measured. 2 antigens are only clinically important. So HBsAg and HBeAg. Okay. When antigen is there, antibody also will be there, right? So when HBs antigen is present, there will be anti-HBs antibody. When there is HBCAg, there will be anti-HBC antibody. When there is HBeAg, there will be anti-HBe. Again, for clinical relevance, anti-HBe is not important. Remember, in antibody, we have 5 types of antibody: IgG, IgA, IgM, IgE, and IgD. The mnemonic gamed GAMED. Always we have to remember IgM is the acute antigen. Whenever an acute infection is there, acute antibody, IgM is the acute antibody. The first one to start is IgM. It's a pentamer. IgG is the chronic antibody. Whenever some infection is chronic, IgM gets converted to IgG by class switching. IgA, remember one thing, it is secretory antibody. Like it is the one which is secreted by the GIT and it helps in the defense of the lining immunity, lining cells of the GIT. We have IgE. Ig is very important in allergic conditions. We are discussing it in neutrophils. Remember, interleukin 4 stimulates IgE secretion. And IgD, it's not very important. So M and G are very, very important because IgM is the acute antibody, IgG is the chronic antibody. So in anti-HBC antibody, we have 2. Anti-HBC IgM antibody, anti-HBC IgG antibody. Sometimes these are measured together called as anti-HBC total antibody. Okay, so 3 antigens, 3 antibodies. So taking again the clinically relevant parameters, we have HBsAg, which is the surface antigen, HBeAg, which is the envelope antigen. I told you HBcAg, core antigen, is not seen in blood. So 2 antigens. Regarding antibody, HBsAg is usually measured as total, a single one. There is no clinical relevance of anti-HB. Anti-HBs is usually taken as a single entity. We don't usually differentiate between HBs, IgM and IgG. But anti-HBc, we take it as IgM, and anti-HBc, IgG. We'll keep it like this for ease of purpose. But usually what is measured is IgM is measured, total is measured. The difference will give you the IgG level. Like if total is elevated, IgM is absent, the entire thing will be IgG. If total is elevated, IgM is elevated, obviously IgM and IgG both are there. Okay. Now what does these things indicate? If HBsAg is present in the blood, it definitely means the virus is there. So presence of HBsAg denotes infection. Right? We'll write it in a different color. Presence of HBsAg indicates infection. What does HBeAg indicate? So EAG always denotes active replication. So whenever HBeAg is present, it means active replication. The disease is active. Now, what does anti-HBs indicate? HBsAg denotes there is an infection. Anti-HBs denotes there is an immunity to infection. So in which condition anti-HBs will be elevated? A prior infection or an immunization. So if HBsAg is positive, anti-HBs is positive, patient has an infection definitely. So there's an antigen and there's an antibody for that. Suppose if HBsAg is negative but anti-HBs is positive, what does it denote? It indicates patient was vaccinated. So he does not have the infection, but he has the antibody. So patient is vaccinated. Right? I'm not bringing this one to this main tabular column, but this can also come as a question. Now anti-HBc IgM. So what does anti-HBc IgM indicate? Something is acute. So there is an acute infection. What does anti-HBc IgG indicate? Whenever IgG is there, it denotes chronic infection. Alright? So if you understand the core concept of IgM and IgG, things are very easy. So if HBsAg is present, it denotes infection. If HBeAg is present, it is replication. If anti-HBs is present, it may be either infection or immunity. If anti-HBc IgM is present, it denotes acute infection. If anti-HBc IgG is present, it is chronic infection. We can take many different combinations. For example, HBsAg is present. HBeAg is present. Anti-HBc IgM is present. What does it indicate? When HBsAg is present, what does it denote? There is an infection with hepatitis B. When HBeAg is present, what does it indicate? There is an active infection. There is replication of the hepatitis B virus going on. What does anti-HBc IgM indicate? Means something is acute. So there is an acute HBsAg infection which is actively replicating. Right? Let us take another example. HBsAg is present. Anti-HBc IgG alone is present. And HBeAg is absent. Okay. Now how will you interpret this serology? When HBsAg is present, what does it indicate? There is a hepatitis B infection, definitely. HBeAg is absent. So, is it an active infection? No. So, infection is inactive. We can say it as latent also. So, there is no active replication, but infection is there. HBC IgG. What I told you, IgG means it's a chronic infection. So it's a chronic latent hepatitis B infection, which means patient was infected with hepatitis B. So patient has a chronic HBC IgG antibody present, but there is no replication going on. But can this get activated? In some conditions, this inactive infection may start replicating again. In that case, HBeAg will become positive and patient will develop symptomatic again. How does he become symptomatic? He will develop jaundice. He will develop a rise in liver enzymes of ALT and AST, and he may become sick, right? So this is my version, right? Just try to understand what does HBsAg mean, what does HBeAg mean, what does anti-HBs mean, what does anti-HBC IgM mean, what does anti-HBC IgG means. Don't confuse capital H, capital B, small e, capital A, small g with capital H, capital E, capital B. This is hepatitis C, right? HAV is hepatitis A virus. HEV is hepatitis E virus. HBeAg is hepatitis B envelope antigen, E antigen. Many people get confused, that's why I mentioned it here. So we'll erase off all the other unnecessary things and we'll just discuss about this question. We'll try to solve it together. So we are taking this question together. Just remember this meaning. So 43 years old male comes to you for pre-op evaluation for hernia surgery, which means symptom-wise he is asymptomatic. He just comes for a routine pre-op evaluation. On routine evaluation, you find him to be HBsAg ELISA positive. So hepatitis B surface antigen is positive. They have mentioned ELISA because usually we do CART test initially. When that screening is positive, we confirm it with ELISA. That's why the word ELISA is given. Don't get confused. So hepatitis B, S antigen is positive means there is an infection. So he was infected with hepatitis B sometime. So you go on to evaluate this patient and find that his anti-HBC IgG is positive and anti-HBC IgM is negative. So this can be given in other terms also, like total anti-HBC is elevated, but anti-HBC IgM is negative. Like that also they can give. But for ease of understanding, I have given as anti-HBC IgG is positive, IgM is negative. So when IgG is positive, what does it mean? It is a chronic infection. So a patient is having a chronic hepatitis B infection. Anti-HBC IgM is negative. So there is no acute infection. Now hepatitis B E antigen, envelope antigen is negative. What does E antigen indicate? Active replication. When EAG is negative, what does it mean? The disease is inactive. It's not actively replicating. So it is chronic inactive hepatitis B. Okay. So we'll see the options. Is it acute hepatitis B? So what will be the serology in acute hepatitis B? HBsAg will be positive, right? Acute. So anti-HBC IgM will be positive. What will happen to the HBeAg? It will also be positive because in acute hepatitis, active replication will be going on. What happens in resolved acute hepatitis B? So it is also an infection, so HBsAg will be positive. In late stages, it may become negative also because not all cases of acute hepatitis B will progress. Sometimes the all viral load will get cleared. But for our sake, we'll take it as HBsAg positive. What will happen to the antigens? Anti-HBC will be negative. Sometimes anti-HBC IgG alone will persist because once resolution of IgM occurs, it will get converted to anti-HBC. So anti-HBC IgG will become negative. There is no active replication, so HBe antigen will be negative, right? But practically HBsAg also will be negative, because once resolution occurs, infection will not be there. So what is the telltale sign of infection? Only anti-HBC IgG will be negative. Okay, so as time goes on with resolution of acute hepatitis, HBsAg will become negative, anti-HBC IgG alone will be positive, HBeAg will be negative. What happens in chronic hepatitis B? HBsAg will be positive, right? Because infection is there. Since it is chronic, anti-HBC IgG will be positive. They didn't give any word whether it is active or inactive. So I think for this term, only these two will be enough to say. To say chronic active hepatitis B, in addition to these two things, HBeAg will be positive. So I think for this question, chronic hepatitis B will be the answer, because HBsAg is positive, his anti-HBC IgG is positive, but there is no replication. So he is having a chronic hepatitis B. Will you treat him or not? So maybe beyond the scope of NEET PG, unless they are symptomatic, unless their SGOT, SGPT levels rise, unless they have jaundice, or there is a family history of hepatocellular carcinoma, you need not treat. Okay, you need not treat every case of HBsAg. Maybe this can come as a question, like patient was exposed to a blood having hepatitis B virus. So like a healthcare professional gets a needle prick from a person who is HBsAg positive, then what will you do? So if you get pricked with the hepatitis B infected blood, so what you have to do immediately is you have to check HBs, anti-HBs, because that is the one which indicates your immunity. So if you are HBsAg negative, but your anti-HBs titer is good, usually they say more than 10 units per liter. If your HBs titer is good, you are not having the virus in your body, then there is no need to vaccinate, because you are already having adequate immunity, so you will not get the infection. Suppose your HBs titer is low, you are not previously vaccinated, means you are having the chance of getting infected. Even if you are vaccinated, always it is good to check your HBs levels after a prick, because sometimes HBs levels, anti-HBs levels may come down with waning immunity. So just because you are vaccinated with hepatitis B doesn't mean that you have adequate immunity. So always, even though you are vaccinated, if you get a prick with the hepatitis B serum, do anti-HBs levels. If it is high, that's all. You know, no need to do any special thing. If anti-HBs is low, you must take the anti-hepatitis B serum. After this, you have to get your booster dose of hepatitis B. Now, since we came about blood prick for HIV is important. So here they'll be giving the exposure categories and source category. Exposures, whether it is just a superficial exposure or a deep exposure, like that, they are giving exposure category codes. Source category, whether the patient is known HIV positive or the source is unknown. Like we have to take prophylaxis only when the exposure is severe or deep or a mucocutaneous exposure and the source is a definite positive. Okay. What about hepatitis C? For HIV, if you read your textbooks, they will be giving EC1, EC2, etc. I just want to tell, to give a prophylaxis, the exposure has to be severe, source has to be clear. Hepatitis C, remember, there is no prophylaxis. But hepatitis B is the only treatable hepatitis. Treatable and curable hepatitis. So if you get a prick with hepatitis C serum, there is no prophylaxis. You have to get infected with hepatitis C and you have to take treatment and get cured, right? Okay. So the actual NEET question was, they are given about resolved hepatitis B. HBsAg was negative, only HBC, anti-HBC IgG was positive, and HBAg was negative. So that was the actual question. So I just, to make you understand, I framed a different question.